Hi, my name is Shane Zumbrunnan. I'm an occupational therapist and certified hand therapist, as well as an owner of a private practice therapy clinic. We want you to keep in mind that you only have to test positive for one of the assessments in this series. You do not have to have all of the tests test positive in order for you to benefit from the kits that we have available to you. So let's do these tests together, pay close attention to your pain, and let's get started. Some of the first symptoms that you may experience with the onset of thumb arthritis will be pain with palpation. This pain and the location that you want to palpate is going to be right here on the outside of the wrist. To locate the area that you should push to identify this area of arthritis, you will straighten the thumb up actively and forcefully. There will be two tendons that will pop up on the outside of your wrist, and you will simply push between those tendons at the base of your thumb. This pain will increase with this pressure and is a positive indicator of thumb arthritis. The pain that you experience with thumb arthritis will oftentimes refer and radiate up and down this outside portion and the palm portion of your thumb. As the arthritis advances, you may notice changes in the look of the base of your thumb. You may find that the shape of your thumb becomes almost blocky in appearance as opposed to nice and smooth and rounded. This is an indicator that you may have more advanced CMC arthritis. Other than the pain that you will commonly experience in the location of arthritis in the thumb, the most common test performed is called the grind test. This test is best performed with assistance from another individual. Your assistant will support your wrist and hand while taking a hold of your thumb and pushing towards your wrist. You will then have them move your thumb in circles while pushing your thumb towards your wrist. If you feel increase in pain, or you feel clicking and popping or a grinding sensation at the base of your thumb, that is a positive indicator for thumb arthritis. Keep in mind that you do not have to have pain or grinding to have thumb arthritis, that your other symptoms of pain or soreness and achiness with activities is just as much a diagnostic tool as this test. One thing to be aware of is that there is also a common form of tendinitis that occurs on this outside portion of your thumb and wrist. So we need to diagnose and make sure that you are not experiencing symptoms of tendinitis instead of the arthritis. To test for this tendinitis, you will grab your thumb with your fingers and slowly bend your wrist down towards your pinky. If you experience a burning or painful sensation through this outside of your forearm and wrist, that's a positive indicator for tendinitis and not necessarily the arthritis. Please keep in mind that you can have both happen at the same time. However, this is oftentimes misdiagnosed and is a common complication that causes people to think they have thumb arthritis instead of tendinitis. If you tested positive with any one of these tests, go to hometherapysolution.com before your symptoms worsen and order your kit today.